The federal government, through the Ministry of Health, has announced its plans to put up an evidence-based health system initiative to reduce maternal deaths in the country. The Permanent Secretary, Ministry of Health, Mr. Sani Bala, made this known at the official launch of the Nigeria Evidence-Based Health System Initiative in Abuja. Speaking at the event, Mr. Bala reaffirmed government's commitment to reduce maternal deaths and improve child health in Nigeria. Also speaking at the event, Commissioner for Health, Cross River State, Professor Angelo Oyoita, explained that the evidence-based health system is a system that enables health practitioners to access information that will aid the treatment of any epidemic rather than treating the disease based on assumptions. Mental disorders affect nearly 12% of the world's population, about 450 million people. As the world celebrates Mental Health Day to raise public awareness, our correspondent evaluates the mental health situation in Nigeria. Mental illness is associated with mental disorders that occur just as any other illness, such as diabetes, malaria, and other ailments. In response to making mental health a global priority and creating awareness, every year, Mental Health Day is celebrated in more than 150 countries. Experts say everyone has potential to suffer mental health problems, no matter the age, gender, or ethnic group.
At least 4% in Nigeria has a mental illness. When I say mental illness, it doesn't mean that I'm hearing voices or I'm walking naked on the road. I may be having problem with sleep, insomnia. Is a form of emotional problem. I may be sad, just for little or no reason, depression. I may be unnecessarily anxious, where everybody is, a normal level of anxiety is needed, but sometimes some are just anxious for nothing. Some are just afraid of staying in the open place. They think they are going to faint, they go into collapse, they begin to have palpitation and cold, they begin to sweat. We call it agoraphobia. Some have specific phobia, some have social phobia. Those are areas of mental illness. Some have sexual problems, sexual anxiety. Some are not married because of abuse in the past. The schizophrenia that is 1% in which people now hear voices, they are rolling the road streets, they are the friendly ones, they are moving around. That is when you see and say, that man, that woman has mental illness. Forgetting the fact that even the little ones I've mentioned are also emotional illness.
In Nigeria, over the years, mental health services have suffered owing to lack of human and financial resources, as well as poor government policy.
Mental health policy in Nigeria. I get saddened by this. We don't have mental health act. The bill has been rejected twice. For years, it has been lying fallow in both the upper and lower chamber. We've been crying. There have been headlines. Nothing is happening. And I believe if Ghana can pass their own mental health act into law last year, and we in Nigeria will claim to be giant of Africa, people live, they die, and government does not care. But I think it's high time the government began to think seriously about passing mental health act. Let it be sacrosanct that we don't have to pay We don't have to carry Ghana must go to House of Assembly. We don't have to carry it to the Senate House to beg our way for Mental Health Act to be passed. And when we have this, we will definitely take care of the old age.
There are so many challenges facing health sector today. However, more funding is needed from the government to promote and increase awareness on various mental health issues which can affect daily life, relationships, and even physical health. Simi Soma with me, Super Screen News.